morning. This is the third edition of our program Mind Your Mind. This is a joint venture of One Good Step and Dr. A V Bhandary Memorial Hospital. Today I will be talking about treatment of depression. In the last two videos we have discussed about the mental health issues and the main cause for it. I again repeat, mental health issues are just like physical health issues. Just like diabetes and hypertension are caused by certain chemical changes in the body, depression is caused by certain chemical changes in the brain. No doubt, some life issues, life events can precipitate an episode of depression. But please understand, treatment of depression medically is a must. So, when you visit a doctor for depression, the doctor will analyze whether it is a mild depression, moderate depression or severe depression. There are criteria by which a doctor comes to conclusion, and what you should understand is he will prescribe as per the severity of depression. If the depression is mild to moderate, many a times psychiatrists just tell you to meet a clinical psychologist or a psychiatric social work consultant. These are people who impart non-pharmacological treatment, which is popular as talk therapy. We call it as psychotherapy. We also call it as cognitive behavior therapy, rational emotive behavior therapy, interpersonal psychotherapy. So many names are there. Basically what they do is they sit with you, analyze your thoughts, analyze your life situation. They teach you how to face it. In fact, depression is a disease which occurs due to negative view of self, negative view of past, negative view of future. They try to impart counseling or psychotherapy by finding out your thoughts. Many a times, negative automatic thoughts make you feel depressed. So they try to change these thoughts. In fact, they teach you how to challenge these thoughts. So, in fact, these are all time tested therapies, and in fact you may require around 10 to 25 sessions of psychotherapy. That will be decided by the clinical psychologist. But if the depression is severe, say depression is leading to suicidal ideas, suicidal attempts, depression is making you refuse to take food, and there are symptoms of depression like delusions of sin, guilt, in which you start believing that you have done a great mistake and you don't deserve to live. These sort of situations will warrant medical treatment. This is where a psychiatrist will prescribe you antidepressants. Please understand, antidepressants are not addictive medications. They are not sedatives. Antidepressants are medications which act on certain chemicals in your brain. These chemicals are called as neurotransmitters. You might have heard of this neurotransmitter, serotonin, dopamine, noradrenaline. These are the neurotransmitters which are involved in the pathophysiology of depression. So, your psychiatrist, he will prescribe you antidepressants, to name a few: sertraline, fluoxetine, escitalopram, amitriptyline, imipramine, dotiapine, mirtazapine. The list is long. The armamentarium of a psychiatrist has lot of antidepressants, and again I repeat, they are not addictive, but they take some time to act. Please understand that there is no medicine which can act on a SOS basis. That if you are feeling sad, you pop up a pill and you will feel happy. There is nothing like that. Please remember this. Antidepressant takes at least 2 to 4 weeks to act, and once the doctor starts these antidepressants, please do not stop without his advice. It's a bad idea to stop antidepressants as soon as you start feeling better. Let your doctor decide when to stop these medications. So, this is about the medical treatment. Of course, there is another part of medical treatment when you are severely suicidal, you have attempted suicide, and you are not able to stop the negative thoughts, which is repeatedly coercing you to commit suicide, or you are getting some voices which tell you to go for suicide. This is the time a doctor may add a drug called as antipsychotic to this antidepressants, or he may add drugs like lithium, and above all this, he may even tell you to take electroconvulsive therapy. Nowadays, we call this as modified electroconvulsive therapy. Modified electroconvulsive therapy is a treatment where a 70 volt current is given to the person who is suffering from depression. It is for few seconds. It is in fact fraction of seconds. And in fact, this also leads to certain chemical changes in the brain, which leads to improvement of depression. Electroconvulsive therapy is a life-saving treatment. I'm sure I'll be talking about this in one of the episodes in the future. Then I'll come to what is called as the lifestyle changes that are necessary in depression. See, depression is a situation where you may not be feeling like doing anything, but many a times you need to force yourself. You need to go for physical exercise. Research has very clearly pointed out that regular walking, cycling, swimming, or even the physical part of yoga is known to improve the release of endorphins and you start feeling better. So please understand this. Try to inculcate at least half an hour of exercise in your day so that you start feeling better. And a few words to people who are helping these people who are suffering from depression, the relatives, the friends. See, my earnest request is please don't preach them. Please understand that this is the time where you have to give your ears, not your mouth. No pep talk can improve depression. Please understand this. You need to see that these people who are talking negatively, who don't want to take treatment, please sit with them, convince them, tell them it is better to go for medical treatment, take them to medical treatment. If necessary, take appointment from a psychiatrist yourself and take them there. And never criticize them. Already they will be in a negative mood. I know they will not listen to you, but at that time, don't tell them that they have wasted your time. Don't give them big lectures about how you have faced difficulties, because these are things which they will never understand. This is the time where you need to empathize with them, support them so that medical treatment is there at the earliest. And especially if they are suicidal, please take care that the means that can lead to suicide, like a weapon or some medications or poisons, search for them, keep it aside, see that they are not in reach of these things. So these are certain things relatives can do. Relatives also, my earnest request is please do not advise them that depression can be overcome by willpower. Please do not advise them that medications are not necessary. These are certain things which I see. By doing this, you will be doing a lot of disservice to them. So overall, depression is a medical illness. And please understand there are medical treatments for that. Lot of research has already proved that these illnesses can be treated with medications. I request all of you to visit your nearest psychiatrist if you feel you have depression. Please understand that this is a venture of One Good Step and A V Bhandary Memorial Hospital, and this is not a substitute for any psychiatric consultation. Please understand this. Go and visit your psychiatrist if you are feeling sad, depressed, hopeless, worthless. Please understand awareness is the key, and after this awareness you need to accept that you are ill, analyze why you are ill and take action. The action involves mixing with friends, improving your social support, going for a walk, going to meet a psychiatrist, take medications if necessary, and take it as long as it is prescribed. Thank you.